weekend draws to a close, I also need to thank all of the NHS staff, all of the other frontline staff who have been working so hard over the long weekend to care for those suffering from coronavirus. We thank you, we pay tribute to you, and we're immensely proud of all you're doing. And can I also take the opportunity to thank everyone who followed the advice to stay at home despite the wonderful weather and despite the challenges and the sacrifices that sticking to the advice presents to many families. I have to say that at the end of last week, we were concerned that people might start ignoring the advice or cutting corners, given the temptation to go out into the sunshine. In fact, the overwhelming majority of people stayed at home and understood the importance of doing so. You stuck to the advice, you denied the coronavirus the social contact it needs to spread, and people should be in absolutely no doubt that by staying home this weekend, you've saved lives, and you've also helped protect our precious NHS at this critical moment in the crisis. So thank you. Your efforts are making all the difference, and please keep them up. We've come too far, we've lost too many loved ones, and we've sacrificed too much to ease up now. I can tell you on the latest data that 290,720 people have been tested for coronavirus. 88,621 have now tested positive, and I'm very sorry to say that 11,329 people have now died from coronavirus. Every one of them a tragedy, and our hearts go out to all of the loved ones who are grieving their loss at such a difficult time. Amidst this sobering death toll, there are also some positive signs from the data that we are starting to win this struggle. But we've still got a long way to go, and as those grisly figures that I just read out show, we're still not past the peak of this virus. So please, continue to follow the advice, now more than ever, to stay home, save lives, and protect our NHS. This week, SAGE will review the evidence of the effectiveness of the social distancing measures that we've taken, and we will consider their evidence, their assessment based on the evidence at that point. I should say we don't expect to make any changes to the measures currently in place at that point, and we won't until we're confident as we realistically can be, that any such changes can be safely made. In the meantime, the government will continue to redouble all of our efforts to buy and deliver the ventilators so we can treat the most vulnerable in our hospitals, to deliver the masks, the gowns, the other protective equipment, to protect those on the front line in the NHS but also in care homes, and to ramp up testing so that NHS and other key staff can return to the front line just as soon as possible. The Chancellor and the Business Secretary are working round the clock to mitigate the damage that this crisis has undoubtedly done to our economy, getting support to businesses, to workers, and to the most vulnerable in our society. So please, once again, keep following the guidance to stay home, save lives, and protect the NHS. If we let up now, the virus will only take full advantage. It will spread faster, and it will kill more people. If we refuse to give in to it, if we keep up this incredible team effort, we will beat this virus and we will come through this national test. Our plan is working. Please stick with it and we will get through this crisis together. Now I'll hand over to, I think it's Chris, to Patrick to talk us through the data today.
Thank you.
Thank you, Patrick.
First slide, please. Reminder, as the First Secretary has said, the aim is to keep the numbers below NHS capacity to make sure by doing so we save lives. The mobility change on this slide shows what we've done, what we've all done. We've stayed at home more, we've reduced our activity in terms of retail, recreation, transport, and in the workplace with more home working, and of course even reduced the presence in parks. That is having an effect in terms of reducing the transmission in the community. Next slide, please. This slide shows the number of new cases, but, and this is an important thing to understand, of course it's not all the cases. This is the cases that have been tested. There are many more cases that have not been tested. The blue bars show the number of cases that have been tested for medical need, and you can see that even allowing for some vagaries of the numbers of tests being done, That's at least flattened off, and we would expect that to decrease. The orange bars show the number of people who've tested positive who are in critical care workers, including those in the NHS. And I'm pleased to say there's more testing going on there. That's an important part of what is happening to detect more cases and also to be able to tell people who are negative. Next slide, please. This is, in some ways, harder data. It's data that actually measures things that relate directly to the infection, and that is the number of people in hospital beds with COVID. And here you can see, as I've discussed before, this is beginning to flatten off. You can see it beginning to flatten off in many parts of the country, not absolutely everywhere, but you would expect this to continue to decrease, flatten, and then start to decrease as the effects of that social distancing that we have in place really feed through into the illness that we're seeing in hospital. And then finally, if I can have the last slide, please. This is the slide of deaths, and again, it doesn't carry all deaths in this. It looks at the deaths in hospital. And the reason it looks at deaths in hospital is that's the international standard and which everyone else is doing in terms of reporting deaths. There are, of course, unfortunately, many deaths that also occur outside hospital. We're tracking behind Italy. We're following the same sort of path. What do I expect to see happen? I think this week's difficult. I think this week we're going to see a further increase. Thereafter, we should see a plateau as the effects of the social distancing come through. That plateau may last for some time and then begin to decrease. That's what we'd expect to see in this very unfortunate death curve. Thank you very much.
Thank you, Patrick. David Shupman from the BBC, lead off with the questions.